The names of the patients whose lives we save can never be known. Our contribution will be what did not happen to them. We are building a fire for someone else to be warmed. We are digging a well for someone else to drink. It's great work. It's very rewarding work. It's work that needs to be done.
We didn't have the obesity rate 50 years ago that we have now. We didn't have the diabetes epidemic 50 years ago that we have now. There's just more and more work to be done around the prevention of disease that is leading to the cost of disease. Hospitals are learning now that they have a role in that space if they're going to be held accountable for the outcomes of the care they're providing.
The objective of any healthcare delivery system should be, let's provide the right care at the right place at the right time and do it in the highest quality way we possibly can. The Kansas Healthcare Collaborative helps to further that goal.
It takes an organized effort where people say, how can we do this as a group to make it better for the individuals that we serve?
It's a collaborative, cooperative, transparent effort to be able to do one thing, and that is help Kansans live a healthier life.
What we hear folks say is, I get that there is a body of research out there and there's evidence out there, but I don't know the steps to take, the policies to develop. That's where KHC comes in.
There's a lot of talk in communities about wellness and fitness and improving health outcomes. What things like the Collaborative can do is engage people. In communities like ours, which are relatively small, the outcomes, the improvements get shared. So it motivates people to do more rather than just talk about it.
We've partnered with them on some grant work. They've connected us with some resources at the state level that have resulted in improved outcomes in our maternal child work. We've done a diabetes project with them.
With the Kansas Healthcare Collaborative, we received a grant to do a blood pressure reduction challenge. The nurse called one patient in particular and explained what we were hoping to do. And she said, I know my blood pressure is extremely high and that should be something I'm concerned about, but I have $5 to get me through the rest of the month. And so my health isn't a priority for me right now. And we just stopped and just kind of let that sink in for a minute. We connected with one of our patient navigators in that community, and in about 25 minutes, we called the patient back and let her know that we had come up with a solution. It wasn't just a quick fix, but a long-term solution. Her blood pressure went from scary high to at the end of the 12 weeks, it was controlled. The group that we worked with, we were able to lower the average systolic blood pressure by 8 and the average diastolic blood pressure by 9. With Kansas Healthcare Collaborative, we're able to do things that otherwise we wouldn't be able to.
We've had physicians and nurses both tell us that this work has changed their life.
KHC has just been a relentless advocate for quality and safety. They are an organization that does not tolerate avoidable patient harm.
It does feel like we're making a difference for patients. They may not know it. It may not come with the KHC label on it, but they are making incremental improvements that are improving the lives of patients.
To see these initiatives impact my family, my friends, my children's friends, people they go to school with, I'm proud to be a part of that.
We start a revolution, one doctor, one office, one hospital at a time.